For a radicular pain, that is a pain along the distribution of the nerve in the leg or in the arm, we generally prescribe a dose escalation protocol of neurotropics as the pharmacological treatment. However, a word of caution here: people should not take the medication by themselves. They should only take it when prescribed by the clinician. And this is a protocol which we have used and has been shown to be effective as per our experience and evidence. And our patients, when prescribed, could use this protocol per se. Again, we would want to mention that these neurotropic drugs do have complications of drowsiness and giddiness in a reasonable number. Other than complications of rashes and water retention when taken over a long term, and hence there is a specified protocol as per which the medication is to be taken, and this should be strongly adhered to. So we generally start with the drug pregabalin, which comes generally as a 75 milligram tablet, and we start with one tablet and increase one tablet each day till the patient gets relief, or till the maximum dose of 600 milligram. Again, if the patient gets drowsiness or giddiness when we increase the dose, then the dose should be reduced and we could add another medication, that is oxcarbazepine. We still would go only up to a maximum of 600 milligrams, whether pregabalin alone or pregabalin or oxcarbazepine as a combination. If there is no relief with a full dose of 600 milligrams, then we would go to the step 2, which is generally adding the tablet duloxetine. Duloxetine is a 20 milligram tablet, and again we would start with one tablet and increase one tablet per day till there is relief, or up to a maximum of 120 milligrams. Again, the idea of increasing it one tablet per day is that if there are any adverse effects of drowsiness or giddiness, the dose could be reduced. If there is no relief with the full dose of 120 milligram of duloxetine, remember we are also taking pregabalin or a pregabalin oxcarbazepine combination up to a maximum of 600 milligram, then we could go to step 3, which is generally adding amitriptyline, which comes in a 25 milligram tablet, and we start with one tablet and go up to a maximum dose of 75 milligram, that is one tablet in the morning and 2 in the evening. If there is no relief with 600 milligram of pregabalin, that is 4 tablets in the morning and 4 tablets in the evening, plus 120 milligrams of duloxetine, that is 3 tablets in the morning and 3 tablets in the evening, plus 75 milligram of amitriptyline, 1 tablet in the morning and 2 tablets in the evening, then you should get back to us, because we would then move to the next step, that is either epidural injections or surgery, depending on how the case may be and your preference. I want to mention here that we generally combine this with methylcobalamin, which is a vitamin B12 supplement, TENS therapy, some hot fermentation, and some local counter irritant gel. So the dose of medication has to be increased till you get relief, and how do we define relief is also important. That is, till you can build up your walks up to 4 kilometers at a stretch and you have significant pain relief and are able to carry on with activities of daily living. You would still continue at this dose till you feel that you are almost fully cured, that is the fully relieved, and then you could start tapering down the medications gradually as you had increased them gradually. This is very important to understand, because you should not stop the medications suddenly. You have to reduce them one by one as you had built up on them. Again here, if reducing the dose causes any increase in pain, you could build it up again, increase the dose again. But if it doesn't increase the pain, you could gradually reduce the medication and stop it. If you have stopped it and after a while the pain recurs, you could start with the medications again, and if you have any issues, you should always consult us or any physician. So friends, that is our dose escalation protocol of neurotropic medications which you could take. Repeating again, please take it only after you get a prescription for this from us or any other clinician. Thank you.